in terms of the challenge, so you guys are in this space, so you know that we've got big challenges in terms of the system right now. We're stretched, as we have been, to be honest, since I can remember. Some of the councils we work with, though, are in a difficult position, like organisations like Birmingham. They've been doing a great job, but they've got challenges in terms of how do we continue to provide the services that we need to our communities. So what we were doing, so I mentioned there that I had a team that I was looking after over in Manchester of nurses, but really saw this gap in terms of how we engaged charity sector communities in terms of what we do, and then looked at, can we do something differently? We know that when we look at that needs pyramid, we want to help people to stay at the bottom of that needs pyramid for longer, keep them out of high cost services. Nobody wants to be admitted to hospital. Everyone wants to be at home, but there are things we need to do in the apprentice space to make that happen. So we basically looked at three things. Can we identify people earlier on? So that's new ways to engage that community, be that through ads, be that through voluntary sector campaigns, be that with GPs. The second thing we looked at is, can we scale the support that we're providing to those communities through new types of channels and technology? And that's really what we do in the AI space. And then lastly, can we do that in a way that saves money to then reinvest into those real world services that can't be replaced by digital or enhanced by digital? And then what we did was build a portal. So this effectively allows us to push out ads, work with GPs, work with voluntary sectors, help carers come into a self-help portal where they get a set of AI coaches, so a dementia coach, a carer coach, somebody can advise you on technology-enabled care, as well as tools, things like discount cards for carers, ID cards for carers, what-if planning tools, and then support and then connection. So supporting people and then connecting them into real-world services. And for us, really the key to a lot of this is working in close co-production with the charities that are out there, engaging and working with that community today. So the way that our systems work is we sit behind the brand of that charity partner in the region. The system looks like that charity to the carer, and we go together to those carer communities, engage and co-design the products that we build, the solutions, based on an understanding of the challenges that carers have got. And that's allowed us to make a really big impact. So right now we're live across the UK. Quite a lot of council regions we're commissioned with now as well. But just in Birmingham, we were able to triple the amount of carers that we're supporting through the addition of a digital service. And that's, as a social enterprise, that's quite minimal cost as well. So a service across Birmingham might be 2 million for the real world service. We're an incremental extra 7k a month to provide the digital platform that can find lots more carers, help them and guide them through self-help tools, and save them time. Importantly, their time stretched. They need to be able to spend time caring, but also looking after themselves and making a saving to the system. Because if we can help that community, they're already helping all of us to stay out of hospital, and that's the way we approached it. So we've really delivered something through Bridgit, which has been co-designed, co-produced with councils, with charities, with GPs, and with the users themselves. I'll just jump briefly on here, but this is our site. So this kind of explains which locations we're live in. Here you can see some of the organisations that we've actually worked with. So we've got mainly charities that we work with in terms of key partners, but obviously commissioning through councils as well that have really supported the journey and allowed us to provide commission services on top of our free platform to carers. We're always reaching out, so we've got statements on our website as part of every project. We like to come and meet people. So last week I was in the Campathon up in Scotland, camping on a beach, keeping costs down, but going to see a partner in North Ayrshire we've just launched with, to meet some of their carers, to speak to some of their teams, to make sure that what we're building is meeting those local requirements. And one of the cool things with AI tech is you can get super personalized and super local. So the way the technology works, it learns what that carer needs, where are they, what's the support that they need, what are those services for them, what are the events for them, and then it actually delivers the support that they require. And then the interesting thing, I guess, just to finish on, is that it's not for us just about that one demographic. We're a social enterprise that's looking to support lots of different people and communities. So we've taken that same platform, which finds people, supports them through AI, and then connects them into reward services. And we're now working really closely with ADAS in West Midlands to provide the platform across the patch for all international recruits, helping them join communities, helping them understand how to navigate and get jobs with all the AI coaches that we've been building with them.
We can see that there's a lot of capable people who are unpaid carers but don't realise they're unpaid carers, and making sure they're supported with really easy user interaction or interfaces and user experiences is essential to kind of keep people away from the door in the coming years, and to enable better outcomes for the people they're caring for. And there are many examples, I think, of wonderful services, wonderful interventions that are done brilliantly at the person-to-person level, but then aren't scaled. And I think we should always think of technology as being a way of not the panacea, the be-all end-all, but a way of scaling interventions to many tens of thousands of people in a very, very cost-effective way. We work a lot of the time. Go on, Darren.
I'm just going to say one real example of that, and I can send these videos out and demos, but over Christmas, we were working with Microsoft to look at how can we take images from a person's home into WhatsApp, assess them, provide a risk assessment of those specific safety issues in the property, and then provide a structured risk falls assessment straight into WhatsApp. So that means that rather than waiting maybe 6 weeks for an OT to come out, you get a report in 3 minutes with some suggestions, some low-cost products from Amazon, some things you can do, and the details of all the local services that can maybe support you that are free in the voluntary sector. But then that's like a broader intervention, but then that then can triage and feed into the OT process. So what you say there in terms of we can do that then, it's 10,000 people in 3 minutes, that's great, but then it tallies into real world services and existing service models to find those people that need that extra help.
Amazing. And that can all be, the wonderful thing about tech as well and digital is that it is measurable. So in terms of creating reports on outcomes, that's almost automatic. You don't need to spend lots of time necessarily interviewing people. You can just see what was done. So in terms of making your lives easier and the impact of what you do more, there's so much opportunity there with technology. We can specialise in taking these wonderful experiences, consultations, examples of products, services, and putting them on the channels that people use. So that bit around connection in the digital sphere is where we can really help.